Hello, my name is Claire Daly. I'm a fourth-year medical student at Loyola University Stritch School of Medicine in Maywood, Illinois. I'm the author of Randomized Controlled Trial of Self-Directed versus In-Classroom Teaching of Narrowband Imaging to Diagnose Barrett's Esophagus-Associated Neoplasia. This study was conducted at Loyola University Medical Center as well as at Kansas City VA in Kansas City, Missouri. Narrowband imaging has been shown to help endoscopists to identify areas of dysplasia within Barrett's esophagus with better accuracy compared to standard white light endoscopy. Previous studies have also shown that endoscopists with no prior experience in narrowband imaging can achieve a high level of accuracy after receiving training in narrowband imaging. However, there remains little data about what is the best way to learn how to use narrowband imaging in Barrett's esophagus. While prior studies have investigated this issue in the optical diagnosis of colon polyp histology, no such studies have examined teaching methods for the use of narrowband imaging in the identification of Barrett's esophagus-associated dysplasia. Therefore, we created a randomized controlled trial to compare in-classroom training with a self-directed training module to teach trainees how to use narrowband imaging in Barrett's esophagus. We enrolled 21 GI fellows and 12 medical students to participate in the study. The trainees were randomized to receive training in narrowband imaging through either an in-classroom training session or a self-directed training program. The self-directed training module consisted of an automated PowerPoint presentation that went over the same material used in the in-classroom training session. We then compared the diagnostic accuracy of these two groups through a standardized exam of images of Barrett's esophagus being examined with narrowband imaging. Our study found there was no difference in accuracy between the in-classroom and self-directed groups. The in-classroom group had a significantly higher percentage of high-confidence answers, but there was no significant difference in accuracy between the two groups when comparing only their high-confidence answers. There was also no significant difference in overall accuracy or accuracy with high-confidence predictions between the two study sites or between GI fellows and medical students. This demonstrates that a one-time training session, regardless of the type of training, improved the accuracy of trainees to diagnose Barrett's esophagus-associated dysplasia, but did not get trainees to similar levels achieved previously in experts in narrowband imaging. This differs from similar studies which examined training methods for the optical diagnosis of colon polyps, in which trainees achieved performance more similar to experts after training. The results of our study may indicate that learning to use narrowband imaging in Barrett's esophagus may require more intensive training compared to learning to use it to diagnose colon polyp histology. Future research in this area should focus on investigating the efficacy of more intensive training programs to teach the use of NBI to diagnose Barrett's esophagus-associated dysplasia to medical trainees. Follow-up testing could also help to determine which training method best improves trainees' ability to retain the information learned during the training session, and whether ongoing training or feedback is needed to maintain proficiency. We hope this study has shed some light on medical training of narrowband imaging in Barrett's esophagus and will help us to improve training techniques so that they may be not only effective but also efficient. Thank you for watching, and if you have any further questions, please do not hesitate to contact us.